So welcome back. I hope you had a good conversation in your group. The reason it looks like I'm talking to you from a basement is because we're having load shedding in South Africa, which has become a sort of regular part of our experience. So I have a little torch so that I can make myself look spooky, and I'm running off my cell phone data. So we will continue no matter what. Keep calm and carry on. I'd like to introduce Emily Munro and Tehila Refaeli. Emily is a professor at the University of Bedfordshire, where she runs some very fancy sounding chair, which I can't remember the name of, but it's very impressive. And Emily's been involved in care leaving research for a very long time. She's looked so young, but she's actually been going at this for almost as long as Mike Steen. And then Tehila Refaeli she is actually quite young. And so she is from Israel and the University of Ben-Gurion in the Negev. And together they have led the COVID study that INTRAC ran quite recently over the last month. And so we're delighted to have them presenting. They're going to present to us for about 10, 15 minutes, I think. And then we'll have about 15 minutes for discussion. And the discussion, I want to encourage you to write some comments in the chat, and then I'll pull those out and interview them. But this might also be a good opportunity if you've done some research on COVID yourself on care leaving and you want to share some of your findings. This would also be a good opportunity, and we would welcome that. So just a reminder, if we could please all switch off our cameras, mute our microphones during the presentation, and we hand over to Emily and Tehila. Thank you so much.
Thanks. So I'm just going to start with a brief overview of the focus of this presentation. The findings are predominantly from a survey that was administered to 46 key experts and informants who were part of INTRAC, really to help us start to understand the implications of COVID in different contexts. I always have a certain amount of trepidation about presenting findings from multiple countries. Neither Tehila and I report to be experts on 15 countries, and certainly some of the subtleties of variations in policy and practice within and between countries are quite difficult to disentangle sometimes in the context of a survey. So be gentle with us if there are things that you think we've perhaps misinterpreted. We'd be interested to know what they are, but if you could just let us know afterwards, that would be great. But in terms of the presentation, I thought I'd just start by situating the findings within the wider context. So thinking about the UN guidelines for the alternative care of children, and what that has to tell us about states' responsibilities towards this group. And there is that acknowledgement that young people who've been separated from their families are entitled and have the right to support, help their psychological recovery, to use the terminology of the UNCRC. And in terms of particularly thinking about their transition from care, the importance of preparation and planning, thinking about the process of transition, taking into consideration young people's age, maturity and circumstances, and also critically providing aftercare support. And arguably those things come into particular focus in the context of COVID. Similarly, I think it's helpful just to think in the broader context about transitions pathways and how they influence and shape and variations in different contexts. And once I've presented this, Tehila will move on to present some of the findings from the survey, and we'll provide some illustrative examples that countries have provided us with around the measures that are being taken in the context of COVID. In terms of transition pathways, I think certainly findings highlighted, particularly in the West, the tendency for young people leaving care to experience accelerated and compressed transitions. So they've been making the move to independence at a younger age than their peers and being expected to simultaneously negotiate multiple changes in their lives, and to do so without the levels of support that young people in the general population typically expect from their families. Certainly one of the pieces of learning from the first INTRAC book back in 2008 was that actually that doesn't apply in all contexts. So in Romania and Hungary, for example, there was the opportunity to remain in your care setting into your early to mid 20s. But actually what was found is that group sometimes experienced instant adulthood. So they moved from a very protective regime and then still struggled when they had to leave and survive on their own. And arguably, and I think it does vary in terms of different countries and contexts, there has been a move or a recognition of the potential and value of something that equips young people more effectively. So thinking about extended and gradual or graduated transitions. And I think that context is just helpful in terms of some of the issues which are relevant irrespective of time and place, but also issues that actually may well resonate and come to the fore in the context of the pandemic. And so over to Tehila to tell us a little more about the survey itself and the preliminary analysis of the findings.
Thank you, Emily. So, as Emily said, about 2 months ago, we sent a survey to 46 INTRAC researchers, each from a different country. In this survey, we aim to explore the impact of COVID-19 on caregiver journey towards independence and the range of responses that have or have not been implemented to support them. For example, we asked the participant to provide data concerning how their country responded to COVID-19 in terms of supporting caregivers. We will present our preliminary results now. The participant consulted with 1 to 36 people in order to respond to the survey. More than a half of them with up to 4 people. We present a snapshot of measures up to July 2020. And as Emily mentioned, there is a limitation that should be mentioned. There are differences in referring to key terms and concepts across nations. For example, what is extended care or aftercare? And therefore, there is a potential for misinterpretation. There is also potential for differences in perspective within countries, as well as variation in policies and practice between states and territories. We can discuss this issue more later. We received responses from 15 of the 46 country representatives, and this is a good opportunity to thank you. From Argentina, Australia, Canada, Germany, England, Ethiopia, France, India, Israel, New Zealand, Portugal, Romania, Scotland, South Africa, and Switzerland. Most data in the responses concerned the whole country, except Switzerland, where the data referred to the canton of Zurich. And we encourage you to participate if your country is not on the list. I'll start with some general background about living care that we believe can impact countries' responses to care leave during COVID-19. The differences in care characteristics between countries were vast. For example, in India, 90% of the children are in residential facilities, while in South Africa, 94% are in foster care. In 13 countries, the legal age for living care is 18, in 13 countries. And this is also the typical age of exit from care in most of them. Only 3 countries do not provide formal extended care options: Switzerland, India, and Israel. Extended care is defined in the survey as a voluntarily remain in care system into legal adulthood. When extended care is available, it is generally up to the age of 21, though some countries offer option for further extension. For example, in Portugal, to the age of 25, in Ethiopia, up to the age of 28 in exceptional cases, and in Germany, up to 27 in exceptional cases of mental illness. Aftercare services are not available in 4 of the 15 countries: Ethiopia, Portugal, South Africa, and Romania. Aftercare is sometimes provided by NGOs, and the age limit is between the ages of 25 and 35. So we are now moving to the responses to COVID-19. In 9 of 15 countries, the state amended legislation issued advice or guidance to practitioners on services and support for caregivers during the pandemic. The countries with no special policies are Argentina, Ethiopia, Germany, Portugal, Romania, and Switzerland. In most of the countries, 11 of 15 NGOs or charities offered advice and guidance to practitioners and support for caregivers. The exceptions are Australia, Scotland, Portugal, and Romania. Most of the participants, 11 of 15, were aware of special initiatives to support caregivers during the pandemic in their country, except of Argentina, Australia, Ethiopia, and Portugal. Emily will refer to the qualitative data about this point later. And now we refer to the changes in practice. I know it's maybe hard to follow, so I will try to summarize this data. The participants indicated several changes in practice following COVID-19 in their countries. The most common one was caregivers' exits from care to independence have been postponed, which was mentioned by 10. Then caregiver received increased contact and support from social worker or other living care workers, mentioned by 8. The least mentioned change was caregiver return to residential care or foster care. This was mentioned by only 2. 5 participants mentioned other changes which present contradicted patterns, such as less versus more home visits in different countries. And it's also important to mention that some changes that seem contradictory appeared in the same country, such as postponement in living care and returning to birth family, or receiving more and less contact from supportive services. And lastly, 3 participants from Ethiopia, India, and South Africa were not aware of any changes in practice in response to COVID-19 in their countries. Emily, back to you.
Thanks. So as you can see, there's certainly been a range of actions in different countries around responses to COVID. It's quite difficult sometimes to disentangle the degree to which that is recommendations for policy and practice, or whether those recommendations are actually being effectively implemented and embedded in practice. But I thought I'd just provide a brief overview of some of the measures that suggests that states are taking their responsibilities towards young people leaving care seriously. So those cases where there's a sense that care leavers are certainly a visible group and on the policy and practice agenda. So some of those examples, in all but 3 provinces in Canada, there's been formal but temporary moratoriums on discharge from care up to January 2021, so allowing young people to postpone their exit, which, as Tehila said, was one of the most common responses from the survey returns. In France, there's been orders which ensure continued support for young adults and an extension of placements without that having to be reviewed by a judge in the traditional way. The example from Australia of extended support rather than extended placements, but thinking about that support package from leaving care workers for those young people who are turning 18 between March and December 2020, and extending that provision for a longer period in recognition of the additional challenges and the context of COVID. And in England, there's been a suite of guidance which is really specifically aimed at providing advice for young people leaving care and recognising the different needs and circumstances of that group depending upon their particular circumstances. So, for example, the provision of advice for those who are in higher education, those who are reliant on unemployment benefits, and also for unaccompanied asylum seekers. And I know also in France there have been particular measures of support for that unaccompanied asylum seeker group in recognition of the risks of isolation for them. And then moving on, I thought I would provide, it's always difficult to choose your selected example, but I thought New Zealand was a nice example of a journey towards implementation of enhanced services and support for young people leaving care more broadly. And then they've put in particular measures in response to COVID. So I thought I'd provide you an overview with that. I understand Ian Matheson's here, so hopefully he will be able to interject if I misinterpret it or there are specific questions about the New Zealand context. So in New Zealand, there's been recent implementation of an entirely new legal framework and targeted support and provision for young people leaving care, where historically this group had been expected to leave and survive at 17. The new extended care model is really designed to be inclusive. Certainly in an English context, there's been concern that young people with the most complex needs often aren't able to benefit from extended care and remaining in placements, whereas the emphasis in the New Zealand model is that it's inclusive and that there aren't eligibility criteria that limit who's entitled to stay. So young people are entitled and eligible to stay with their former carers up to the age of 21. And if they're in residential, they would need to move from that residential placement, but would still benefit from the opportunity to stay with foster carers up to 21. And interestingly, there's also an entitlement to return to kin or non-kin carers up to the age of 21, if that's possible. So that right to return is part of the package of measures, which is interesting. Again, going back to an English context, because it's the one I'm familiar with, that was piloted in England and actually in practice was rarely taken up. So it'll be interesting to understand the take up of that. But certainly the psychological benefits of that in terms of knowing you have somewhere to return to in times of difficulty. Also in terms of developments, the provision of aftercare and access to that up to the age of 25. And then thinking about the context of COVID, I think there's some nice examples that were provided in the survey response in terms of there being national guidance to those providing transitional care for this group. Proactive workers who were providing crisis support and helping young people to access accommodation and food, increased contact, and I quite like some of the kind of creative responses in terms of access to not Netflix or online cooking demonstrations, and just a whole set of informal arrangements which were, I think, really designed to reduce isolation and provide support in what was an unusual time for all of us. There was also recognition of the importance of technology, phones and phone credit, and the capacity to communicate and stay in touch with peers and also with workers and wider support. So that's just a flavour of the New Zealand context. As I say, I hope Ian will provide a bit more detail if people are interested in the specifics around that. And also, I think there's interest in thinking about variations in responses. So headline reflections, I think it's interesting that the majority of countries suggest there have been, if not changes in practice, at least an acknowledgement that policy and practice do need to change, and an acknowledgement of the specific needs and circumstances of this group. A sense of paused transitions. So 10 countries, there was the opportunity, at least for some young people, to delay their exit from care. It'll be interesting to explore how long that paused transition is permitted for, and actually the management of that transitional arrangement those transitional arrangements post lockdown. So the degree to which it's a temporary measure and a protective one, or whether it moves to something which is more long-term, and issues around waithood are potentially quite interesting going forward. In terms of return to care, that was rarely identified as being an option, but in 6 countries, young people had apparently been returning to live with birth family. What's not clear and what would be of interest is the degree to that, if that was a positive and proactive choice, or a response to constrained choices and the absence of alternative support. There were really wide variations in the visibility of care leavers in the midst of the pandemic, and the degree to which they could access services and support. And what's clear is the kind of variations both within and between countries in that respect. And I think one of the kind of headline issues is that question of territorial injustices. So some young people are able to access additional support, whereas others have seen a reduction in emotional, practical and financial support. So those issues of social justice, and I think that lottery depending on your postcode and or the decisions around your care placement and where you're living, really do come to the fore. And I think I'm going to leave it there. I'm conscious of time. We're really keen to make sure there's opportunity to hear more about the wider work that's going on around COVID and different policy and practices. So we will open up for discussion and debate. But thank you to all those who contributed to the survey, because it's very much informed by your responses. So thank you.
So thank you very much, Emily and Tehila, for presenting cogently and briefly the findings from this fairly quick assessment of COVID around the world. And I want to just echo your earlier invitation that if a country's not had a chance yet to participate in the survey, that we're still open for business. So don't miss out on the bandwagon. Things that stood out for me that were, I think, quite interesting is the diversity of responses across different countries. Some which seem, and you've used New Zealand as a good example, have been really responsive and thoughtful, and yet some other countries have not really changed anything. It's sort of carried on with business as usual. Very clearly here, but I think from some of the data we've spoken about, the difference between the role of the non-governmental organizations versus the state. And the degree to which the state takes the lead in addressing these issues versus leaving it to NGOs to handle themselves also seems to be. So that gap between the formal response and the informal response is perhaps also something important. And then it's been lovely to hear about New Zealand. I think, I see there's a comment there from Ian, just popped in quickly. I think for me and perhaps for many of us, New Zealand has the Prime Minister we all wish we had. So no surprise that New Zealand should be doing such a great job in thinking about the humanity of care leavers. We had 2 questions come in so far. I'm going to throw them both out at you to answer, and then I'll see if I can look through the last comments. We literally have perhaps 7 minutes for this. The one was a question about funding. Is there funding available for COVID care leaving research that you're aware of, specifically in this question in East Africa? And then also a couple of people have been wondering to what extent the response to care leavers correlates or is associated in some way with 2 main things. The one is the actual pattern of the pandemic itself. So if it was a very severe or quick and that, but also how the country responded to COVID generally. So if there was a good general response to COVID, was there also a good response to care leavers? And I wonder if you have some responses to either of those questions.
Emily, would you like to start? Or should I?
I can do. So sadly, I'm not aware of funding opportunities which are country specific. I do certainly know that a number of countries have had targeted calls for social research around the impacts of COVID, and certainly, again, going back to the English context, a concern with particularly vulnerable groups, of which care leavers would be seen as one. And certainly, from the survey responses, there has been engagement in this as an issue, and funding opportunities, or opportunities to slightly revise studies that were already underway to recognise how young people's experiences have varied due to COVID-19. I don't know if you've got anything else to add around that, Tehila.
No, I have the same answer. I'm just thinking, from my experience, that the country, or I can't really tell about funding, but I can tell that the country is really interested in our, like the government is really interested in our findings. I have this experience, like they really want to learn, but they don't really offer some funding for doing research around that. So it's a very interesting experience from my side. I don't know, how do you feel about that?
Yeah, absolutely. And then, sorry, the second question was around the patterns. I haven't discerned patterns around COVID responses and the severity of the pandemic. My observation, perhaps, and I do need to revisit the data, so it's more an anecdotal perception rather than research informed, if you like. But my sense is that some of the patterns of response reflect a broader acknowledgement or visibility or invisibility of care leavers as a population. So certainly in England, the needs and experiences of care leavers are very high on the policy agenda, and that is reflected in the acknowledgement of that as a specific group in government guidance, and there's also been funding directed to supporting care leavers as a group. Whereas I think in other contexts, sometimes care leavers benefit from wider measures to support young people more broadly, or young people in particular circumstances. So those who are at risk of non-engagement in education, employment and training, for example. So I think there's interesting variations around some of that, which there's potential to explore further. So that's my initial reflection.
Yeah, but it's important. I just want to
Yes.
add a little bit to this. I think we didn't ask specific how your country dealt with this, or still dealing with a pandemic right now. So we don't really have the data to compare between these two questions. As Adrian, you asked about this, but I totally agree with Emily that maybe we should see the general policy concerning care leavers and how it changed or developed during the pandemic as a good question to explore in the data we have.
So thank you to both of you, and thank you also to the 15 countries that did participate. I think this provides a really useful painting, in a sense, of where things are. And if we can deal effectively with something like COVID, which impacts so directly on the journey towards independent living, towards young adulthood. I mean, I think this is, as a public health issue goes, such a critical issue in terms of its impact on young people transitioning into young adulthood. We could perhaps learn some important lessons that would shape the future. And I'm mindful of a comment that Robbie Gilligan made in Ireland, which has no extended care program, that they've introduced extended care now in response to COVID. And he is hoping that this might just be a sign of a shift in policy that will continue beyond COVID. And maybe sometimes COVID might bring out the best in us. So thanks to both of you. And again, just a reminder to everybody, if you would like to still participate in the study, please do so. And if you need some help, just email the INTRAC Exco, or if you know Tehila personally, you could email her and she can share the link with you. She's smiling and waving.
Yeah.
So thank you for this session, and I'm handing over to Vada to handle the last few minutes.